टूटी, एक हड्डी टूटी, दूसरी टूटी, तीसरी टूटी, चौथी टूटी, हमने वेट बेयरिंग एक्सरसाइजेस छोड़ दी। लड़कियों को क्या मिलता था? स्किप रोप, बॉयज को गुल्ली डंडा। क्या होता था? गुल्ली डंडा नहीं मिलता था। फर्स्ट डे आई यूज्ड टू कम होम 2:30, थ्रो माय बैग, हैव माय डिनर, एक घर की दीवार फलांगी दूसरे घर में, दूसरे घर की दीवार फलांगी तीसरे के घर के अंदर, इसके आम तोड़े, उसका नींबू चोरी किया। क्या हो रहा है? जंप कर रहे हैं, आप जंप कर रहे हैं, गिर रहे हैं, ये एक्सरसाइज हो रही है ऑटोमेटिकली। अल्लाह की तरफ से एक्सरसाइज हुआ करती थी टिल मगरिब की नमाज, फिर हम मगरिब के घर वापस आ गए। लेकिन दिन भर हमने फिजिकल एक्टिविटी की, फिजिकल एक्सरसाइज की। आजकल क्या हो रहा है? घर आए, देख रहेगा अम्मा ने खाना लगा दिया, खाना भी अम्मा शायद दिवाले से मुंह में डाल रही है, इस पे लगेगा। I have patients, 12 years old boy, girl, coming with intense pain in the carpal, metacarpal joints, hands. अम्मा, ऐसा इसके उसमें बड़ा सख्त दर्द होता है, में रात को रोता रहता है, सुबह स्कूल भी जाने के लिए नहीं करता, क्या कैसे इलाज क्या कर सकते हैं? उम्र कितनी बेटी? 12 साल। लेकिन ऐसा एक बात बताएं, पता है इसने लोकल कंपटीशन जीता है, 1 मिनट के अंदर 130 व्हाट्सएप भेजता है, 1 मिनट में 130 व्हाट्सएप भेजता है बच्चा। You are asking for trouble. I tell you, you people are asking for trouble. Unless until we stop it now, it's going to be 12 years old having carpal metacarpal joint pain because repetitive strain इसको बोलते हैं हम लोग, repetitive strain. पोस्चर क्या है? टिपिकल पोस्चर क्या है बच्चों का आजकल के? जिन्हें मैं इसका प्रमाण के नो, When was like this? 12 साल का बच्चा, बोन्स भी ग्रो कर रही है, यही पोस्चर रह जाएगा। आपकी दादी नानी का पोस्चर ऐसा है? नो, उसकी 90 साल के बाद उम्र के साथ साथ हड्डियां टूटती जा रही है, उसका पोस्चर क्यों चलती है वो? क्योंकि ये लामहला उम्र के साथ से हड्डियां टूटनी शुरू हुई, ऑस्टियोपोरोसिस होगा आपका। लेकिन इस जनरेशन का ऑस्टियोपोरोसिस बड़ी जल्दी आने वाला है, इस जनरेशन का पोस्चर ये होने वाला है। ठीक है, मैं नहीं हूँ इस दुनिया में, लेकिन मेरे वर्ड याद रखना आपको। एक डॉक्टर आया था, उसने हमें अकलमंदी की बात बताई, प्लीज अपने पोस्चर करेक्ट करो, प्लीज हर चीज की लिमिटेशन होती है। ये भी अल्लाह ने कहा कि सुबह शाम नमाज ही पढ़ते रहो, 5 की नमाज पढ़ो, दूसरे काम भी करो, दुनियावी काम भी करो। हम क्या कर रहे हैं? यहाँ से घर से चाहिए, खाना भी किसी को हो रहा है, पीने भी किसी को हो रहा है। हमने इसका अब्यूज शुरू कर दिया है, इंटरनेट का, गूगल का, मोबाइल्स का अब्यूज है। कमिंग बैक टू ऑस्टियोपोरोसिस, हर बच्चा हर बच्ची प्लीज स्किपिंग रोप खरीदे, घर जाके 50 दफा स्किप करें, 50 दफा। ये डायग्राम नंबर वो क्या है? ये फ्रैक्चर जो होता है लंबर स्पाइन का, ये कभी मारने से गिरने से नहीं होता, ये ऑस्टियोपोरोटिक फ्रैक्चर ऑटोमेटिकली बिस्तर में लेटे भी हो जाएगा। तो ये मत समझिए कि बिस्तर से गिरूंगी या मोटरसाइकिल से नीचे गिरूंगी तब मुझे ये फ्रैक्चर होगा। नो, these fractures are isolated fractures. They can be while you're sitting in bed, sitting in chair. क्यों? Bad posture, bad diet, no exercise or zero exercise. Prevention of osteoporosis. The bones will stay strong or will continue to grow strong until the age of 45. After 45, you start losing calcium. Then you can start having back pain. Then you will start having fractures. And by the age of 60, 60 or 70, so if you want to prevent these fractures, if you want to avoid these injuries to your back, to your spine, weight-bearing exercises, skipping rope, posture, करिए जरूर इंटरनेट कीजिए, पोस्टर ये देखिए चेयर प्रोफेसर साहब ने कैसे बनवा के रखी हुई है, हाई बैक चेयर, इससे मजा आता है, थोड़ा स्पाइन पोस्टर, लो बैक चेयर्स नो। देखो कि कैफे में चाय पीने की ठीक है, लेकिन 12 घंटे उस पर नहीं गुजारने आप लोगों ने। ओके, ऑस्टियोपोरोसिस, थर्ड वेरी इंपॉर्टेंट इशू, बैक पेन, हर घर में एक आदमी होगा। दिस इज international figures, every human being, whether it's in France, whether it's in UK, Pakistan or Bangladesh will have back pain in his lifespan from the age of 50 till whatever time he lives in. You will have it. You can't say no, I not. You will have back pain. How to avoid it, how to get over it, that's what we need to discuss today. But probably that I do in a small group because then I'll have to do some practical demonstration, lie down on the floor and what sort of exercise. So we'll be touching osteoporosis, we'll be touching back pain, which every one of you will have it, female more often because of obviously, because of build, because of hormonal things what we have, and posture. So second topic what we're going to discuss today and tomorrow is back pain. Third, which again very common, is osteoporotic fracture. मेरे ख्याल में पाकिस्तान में भी हर घर के अंदर एक ने एक दादी, एक ने एक दादा, फुफी, कोई उम्र रसीदा इंसान होगा जिसको हड्डी का फ्रैक्चर, जिसको कूल्हे की हड्डी का फ्रैक्चर होगा और बिस्तर पे होगी, बेड रिडन, ना वो हिल सकेगी ना चल सकेगी, लेकिन जिंदा है. Problem is she's alive, but she's no use to the community. She can't come out. Someone has to change bed pans, someone has to change bed sheet. Someone has to push her out, in and out. 1 year, 2 years, 3 years. Between 3 and 5 years, they will die. Why? Later, what will happen? They will have back sores. Have anyone seen what a back sore is?
No.
Yeah, it's a wound on the back side where the skin is in direct contact with the bed sheet, with the mattress, or the bed. Lying for 8 hours, 12 hours, because they're paralyzed, because they got fractures, because just like this, they have back sores here, back sores there, and you see them. Once you have back sore, I don't use any medicine to cure it. That will be well controlled, but I have yet to see back sore being covered by healthy skin. So again, prevention of back sore. How to prevent it? We do some demonstration. How to turn the patient every 4 to 6 hours, turn them onto the side, probably we can avoid. But once you have back sore, there is no remedy to it. Yeah, there are antibiotics and medication, medicine, but no cure to it. So we'll be touching briefly on back sores, osteoporotic fractures, okay, which is spine fracture and which is the hip fracture. Yes, I'm very pleased and happy to see this time on my visit to Pakistan that they are being operated, which is very good. If an elderly in your family, male or female, has a hip fracture, as we call it, right or left it is, unless until they are medically unfit, please go for an operation. I won't say that I get money out of this operation, but I can guarantee you this will be life-changing procedure. Imagine you lying in bed for 12, 14 weeks time to let your fracture heal, or you are out of bed after 24 hours. Hip fractures are never kept in bed in modern times. So if any one of your relative, they are living in government hospital also, so money is not the issue. It's only patient's motivated. No, but no. I tell you, she will be alive for 3, 5 years time. She will be burden on the family, she will be burden on the society, and the whole atmosphere changes, isn't it? The whole house atmosphere changes. If there's Dadi or Nani sick, lying in the corner of the bed, people don't intermingle, they don't laugh, they don't share jokes. वो सुन रही हैं, वो देख रही हैं, बुरा लगेगा, वो बीमार हैं, वो हंस रहे हैं, वो शादी मना रहे हैं, बर्थडे कर रहे हैं. So yes, it is available in the hospital, government hospital. Have it done. It's a quick, easy procedure. One screw in, one screw out, or change part of the hip. So hip fracture nowadays are treated very differently. When I started medicine, they were treated just with lying in bed with a rope and a weight for it. Just put the each लटका देते थे, वजन नीचे लटका के और 6 हफ्ते तक 12 हफ्ते तक रखते थे. But now time has changed. You can go for procedure, an operation, which I can discuss in depth and detail in my slides, and have it operated. Third, I think the important bit what we'll be touching today is again related to you. Females in particular, because of your hormonal cycle, because of your age, back pain to mechanical back pain, which a rickshaw driver or a laborer has. Okay? So make sure that there's a different pain. It's in the back, but the treatment, the protocol, and prevention is entirely different to what we have back pain for mechanical back pain. Yours one is hormonal, periodic back pain, which is slightly or much more different to what you have. Third important, plenty of you must have had a wrist fracture, isn't it? You are on the street, stepped on a carpet, or stepped in the kitchen. They are also nowadays operated with a quick procedure, 10 minutes procedure, put a wire through, put a plaster, and get going. So with the rapid advancement in science, things are changing. What was bad yesterday is good today. What was good yesterday is bad today. So keep up with the times. जैसे change आता जा रहा है. We will be doing practical workshop here tomorrow, maybe today as well, to apply plaster of Paris. Each one of you should know how to apply plaster. And what is the aftercare? What is the aftercare? Because this plaster is not for a day or two. This for 6 weeks' time. Either it's on the leg or it's on the wrist. And I don't think so. Medical, my friends and colleagues in this country, it's my fault. Do not tell patients what to expect. They just say, plaster, off you go home. They do not tell them how to take care of the plaster. What are the complications? What are the risks of having a plaster in hand or a wrist? So each one of you will apply plaster today or tomorrow. If you can have some names, how many are interested? Because I have got some stuff with me, but I might have to buy more plaster, more rolls. So one of the coordinators here will be in touch with you. Put your name down, give me numbers, 100, 200, how many would like to do a plaster. So we'll do this thing tomorrow. But care is very important. It's not only application plaster. How to take care of plaster, how to get going, how to scratch your head, how to eat, how to drink. Because 6 weeks you can't be just like this. No. You have to be a bit active. You won't be boxing for 6 weeks time, but you'll be doing more or less day-to-day activity. Okay. Now, last but not least is very, very important is patient privacy, patient dignity. And I would suggest each one of you, can you raise your right hand up? Go, with me. Right hand up. And repeat what I am saying. Repeat what I am saying. Inshallah.
Inshallah.
I will treat every patient as if she or he is my sister, my brother, my mother, my father, or my relative. Thank you very much. What we did now? What we did now? You must have seen, go to clinic, go to the hospital. Professor Sachs is the doctor. There are 15 relatives standing behind her or in front of her, or you will be 15 of them. Okay? Who is there? Chacha, Mama, Mumani, next door neighbor, Rikshawala, Qureshi, Kiradar. Listen to me. Private. This talk is private talk, isn't it? Would you like to discuss your private issue with Rikshawala?
No.
Okay. So this is dignity. Patient privacy. Only patient and maybe one relative. And again, I would like you to raise hand, but can we as a name member raise our hand and say, I will never examine a female patient all alone. I must have a chaperone with me. उसमें ममानी आ जाए, रिक्शा वाली आ जाए, प्लीज कभी फीमेल को अकेले में एग्जामिन करने की कोशिश भी मत कीजिएगा। और बोले अल्लाह ताला देख रहा है, गर्दन पकड़ी जाएगी ना। They need respect, privacy. Okay. So I think I should wrap it up with this thing now. We'll do practical demonstration from now onwards. Professor will take it on to the ultrasound room, I do the osteoporosis and other businesses. But the key message today is patient needs privacy in the dignity and they should be treated with dignity.